What are the symptoms of coronary artery disease? By and large, we should understand the symptom depends upon how much is the plaque percentage within the coronary arteries, how much is the artery blocked. If it is happening, generally the patient starts getting symptoms whenever the patients exert. That is because when the patient's sitting, heart rate is less, but when the patient exerts, the heart rate increases to more than 100, 110, 120 like that. And because of the blocks, the blood supply won't increase. In normal people, the blood supply increases because of increasing pumping of the heart. But here, because of blocks existing in the coronary arteries, it doesn't increase. And patient gets a discomfort in the chest, which is classically called as angina. Angina is a typical discomfort happening in the chest, anywhere from the jaw to the umbilicus, radiating to both arms or to the jaw, especially discomfort increasing on exertion, decreasing with rest is called as classical angina. And sometimes if you have a sorbitol tablet, if you keep it under the tongue, the pain decreases. This is what is the commonest classical presentation of coronary artery disease as angina. Once the blockages inside the artery progress, it becomes more than 90% and 99%. They start getting symptoms of same symptoms on exertion, even at rest, that is called as rest angina or unstable angina. If the arteries get totally closed because of the plaque ruptures and the clots forming inside the artery, then that is called as myocardial infarction. That is the severest type of pain which patient gets. Especially, you will not sometimes be able to describe it, but associated with severe sweating, and the pain is lasting longer, more than 20 minutes or so, and unless the patient is treated, he might develop into trouble. And sometimes sudden beating abnormalities could lead to death too. That is why we should not wait till the arteries get occluded totally, and we should come in the stage of angina itself. Coming to the other symptoms of coronary artery disease, the patient may not get angina. Sometimes in patients, especially in diabetes and females, they could just have exertional breathlessness. That is the feeling of short of breath, and that is actually called as anginal equivalent. And then other types, sometimes patient could just present with palpitations, fatigue, syncope very rarely. But by and large, coronary artery disease presents with the classical discomfort in the chest, which we call as angina.